Hey.
Hi, I'm Shivan Sarna. What a pleasure to have you here. What if you could fix a variety of things, including your SIBO, by drinking the elemental diet? What is that? That's right. It's a faux milkshake. Wink, wink. Delicious. Wink, wink. Better than it used to be. Medical food that you just drink and don't have anything else for a certain and specific period of time. It is the number one most effective treatment for SIBO, and we're going to dive into it. We have the incredible Dr. Allison Siebecker here with me today. Hi, Dr. Siebecker.
Hi, everybody.
She is a world-renowned SIBO specialist and naturopath, and one of the strongest advocates for education and SIBO in the universe, the world. And then we have Dr. Roy Steinbock and his beautiful and incredibly brilliantly talented, smart wife, Debbie, who is a nutritionist who specializes in the elemental diet. And when people are talking to us, Dr. Siebecker and I do small group coaching for SIBO. We have courses and stuff. And when they have a more intricate question about the elemental diet, we're like, you really should talk to Debbie about that. Right. So we're going to be talking today about that. She has a presentation. They have a presentation for us. And then we're going to talk about how you can work more closely with her. And we're going to get in some Q&A. And if you have any questions, please put them in the Q&A box early. ASAP, baby, because we want to get as many as possible, but this is a limited scenario. It was like we weren't going to be able to do this until March unless we did it today for an hour. Let's go. All right, Debbie, Roy, if you want to put your presentation in there, we will hide our cameras and then we will get to it, because this could be the answer for a lot of people.
Can you see our slides?
Yes, I can. All good.
Woohoo.
Okay, perfect. Okay. Go ahead.
Welcome, everybody. Today we are going to talk about elemental diet success for SIBO and beyond. My name is Debbie Steinbock. I am the owner of Mindful Nutrition. I've been a certified holistic health and nutrition counselor for 25 years, since the year 2000. I got into nutrition because of my own personal interest. I got into nutrition because of my own digestive disorders, which gives me a really personal interest in what we're talking about today. I work with clients with complex digestive issues such as IBS, SIBO, IBD, autoimmunity, food allergies, and sensitivities. I live in Boulder, Colorado with my husband, Roy, and we have 3 kids, one who's away in college already. And what Roy and I started doing is sharing something different every time we talk, so that you will never hear this unless you hear this talk, because we've never shared it on our website or publicly before. And it has nothing to do with elemental diets. So the thing that I'm going to share about myself today, so you get to know me a little bit better, is that we have a 15-year-old daughter together. When she was born, I did not know any lullabies, but what I did know was a lot of songs, particularly in the glam rock and rap genre, from the late 80s and early 90s when I was a teen. So picture singing Beastie Boys, Paul Revere, softly and lovingly to a child, because that is what I did when our daughter was born.
Okay, and I'm Dr. Roy Steinbock, and I'm a board certified and holistic pediatrician. I've been practicing since 1995, and I started Mindful Pediatrics in 2006. And I consult with patients on complex and chronic health conditions, particularly digestive disorders, immune disorders, autoimmunity, allergies, eczema, asthma, anxiety, OCD, PANDAS, depression, ADHD, and a bunch of other disorders. And along with Debbie, I'm the co-creator of the Elemental Diet Success Plan program, which we'll talk about a little bit later. And that my little special thing I'm going to share is that most people don't know this about me, but that I am a songwriter and have an all-original rock band.
And he plays and builds guitars as well. We have a soundproof music studio in our basement.
All right, so the legal stuff real quickly first. By viewing this presentation, you agree to the following terms and conditions. The information in this presentation is for educational purposes only and is not intended to be a substitution for professional diagnosis and treatment. Please consult your healthcare provider before making any healthcare decisions. Our goal in this presentation is to present our knowledge and clinical experience. And for your health and to achieve the best outcome possible, please consult with your healthcare practitioner before implementing an elemental diet.
So what we're going to cover today is what an elemental diet is and how it works. We're going to go through elemental diet terminology. We're going to talk about the benefits of an elemental diet for SIBO and a couple other conditions, but we're really going to focus today on SIBO. And then we're going to present a bunch of case studies. I put in a lot of new ones from our clinical practice, showing the uses of an elemental diet for hydrogen, methane, and hydrogen sulfide SIBO. And then we're going to give you guys an overview of our 3-step process for elemental diet success. So the obvious first question is, what is an elemental diet?
All right, so hold on a second, I gotta get this out of my way. Okay, so an elemental diet is a diet of medical shakes designed to provide complete nutrition for the period that you're on them. It's powdered nutrients that are considered pre-digested and are delivered in an easy and absorbable hypoallergenic form. Elemental formulas contain everything that you need, including proteins, carbohydrates, fats, and nutrients that human requires, broken down into their simplest form, otherwise known as elements. They require minimal digestive effort and are absorbed rapidly high up in the small intestine in the first 2 to 4 feet. Digestion requires a lot of our body's energy and resources, and by giving a body a break from digestion, you free up those resources to be used for healing and repair, which is why an elemental diet is so effective for so many different conditions. So what do the elemental shakes contain? I mentioned it a little bit already. So instead of protein, they generally contain free-form amino acids. They also contain carbohydrates because we need those, typically monosaccharides, either glucose, fructose, dextrose, sometimes glucose polymers like maltodextrin, and then some formulas contain stevia, and then homemade formulas can contain honey. They need fats. Some formulas have them already built in, and some need them added separately, but typically we use coconut, palm, MCT, flax, or fish oil, and they contain other nutrients that you need, vitamins, minerals, and electrolytes.
So how does an elemental diet work? Elemental diets are antibacterial, and this is really one of the main reasons that we're talking about them for use with SIBO. So the nutrients in the elemental shakes are absorbed very rapidly and high up in the small intestine, which leaves only little substrate for bacteria that's further down. So without having any fermentable fuel, bacterial populations decrease by starvation, aka death, and bacterial overgrowth is eradicated without the use of any antibiotics or herbs. Newer research is also suggesting that elemental diets selectively reduce these pathogenic and overgrown bacteria while allowing for the restoration of a healthier microbiome. Elemental diets are also anti-inflammatory. Because nutrients in the elemental shakes are broken down, also known as pre-digested, digestion's easier and the gut lining gets a rest. This reduces the stimulation of the immune system and decreases inflammation. Elemental formulas are hypoallergenic and contain amino acids and very simple nutrients, which minimizes your exposure to potential dietary allergens like whole proteins and other complex compounds. With less irritation and immune stress, the intestinal lining can heal, which reduces intestinal permeability, aka leaky gut, which is a driver of systemic inflammation. And studies on the elemental diet have shown that they downregulate pro-inflammatory cytokines and upregulate anti-inflammatory mediators, which helps calm the immune response.
So now we'll talk about elemental diet terminology. There's a few things that we need to clear up. So first we'll talk about elemental versus semi-elemental formulas. And here we're talking about the content of the shakes. So elemental shakes are fully digested proteins into amino acids, the building blocks of proteins. And they only have amino acids. They contain all the other nutrients that we discussed as well, but in terms of the protein source. And semi-elemental shakes contain partially digested proteins, which then include short-chain peptides, both di and tripeptides, which typically come from either whey protein isolates or sprouted brown rice isolates. They also do contain some free-form amino acids as well. And here's a diagram. You can see that the bigger protein gets broken down into smaller polypeptide chain that gets broken down even further into the dipeptide and tripeptides. This is the semi-elemental formulas. And if you break those down even further, they become elemental because of the amino acids. And only amino acids and short chain peptides can be directly absorbed across the small intestine lining without additional digestion. But there are a few other ways that the shakes vary as well. So we talked about the protein, amino acid versus short chain peptide. They also vary in terms of carbohydrate content and type. So sugar content, how much and how little in different forms, like I mentioned before. Some of the shakes have the fat built into them. Some shakes come with no fat and you need to add the fat separately. And then also the quality of the nutrients, things like methylated B vitamins. Some have allergens or things that people might be sensitive to. lots of different flavor options now these days, fortunately. And then last thing is access, because these formulas are not available all over the world. And so the next thing we'll talk about is elemental versus partial elemental diet. So when I talked about elemental versus semi-elemental, that was the different content of the shakes. Here we're talking about how to use the shakes. So an elemental diet is 100% of the nutrients come from the elemental shakes, where in a partial elemental diet, part of the nutrients come from the elemental shakes and the others come from solid foods. And generally, of course, we recommend non-inflammatory, healthy whole foods.
So let's talk about the benefits of elemental diets for a variety of different conditions. So we'll start with small intestinal bacterial overgrowth and irritable bowel syndrome. This has gotten lots of attention in recent years, thanks to the lovely Dr. Allison Siebecker and Mark Pimentel, across other people like Shivan Sarna and all the community outreach that she does. So the reason that this works for SIBO is there's 3 ways to treat SIBO. We have antibiotics, we have herbs, and we have an elemental diet. So antibiotics and herbs, in theory, each target certain bacteria, but all bacteria, in theory, would respond to starvation. So an elemental diet is also a great option for very high gas levels. There's an average of 70 parts per million reduction in hydrogen and methane gases, although as you'll see from the testimonials that the case studies that we'll share, we've actually seen even higher than that. And elemental diets help avoid multiple rounds of antibiotics or herbal antimicrobials, especially in tough to treat cases. So there's been a couple studies for SIBO. In 2004, Dr. Mark Pimentel studied the elemental diet using Vivinex. A treatment time of 2 weeks was 80% and 3 weeks was 85% effective in eradicating hydrogen SIBO, which was the only gas type they looked at the time. And this was shown by the normalization of the lactulose breath test. 65% of people experience an improvement in their IBS symptoms, and it's been studied to show that about 70 to 80% of IBS patients have an underlying case of SIBO. A more recent study in 2023 was done by Dr. Ali Renzai, and he studied the elemental diet using M-Biota. So a treatment time of 2 weeks showed an 83% success rate in eradicating SIBO and EMO together, also shown by repeat lactulose breath testing, and an 82% improvement in GI symptoms. And then I put their little chart that showed, broken down by gas type, whereas really hydrogen SIBO was 100% eradicated in everyone in their study.
Can we have a moment just to go 100%? Oh my goodness, that's amazing.
I know. It's amazing. And honestly, what I've been saying, you guys have heard me say this for years now, that I would say that the success rate that I'm seeing across all gas levels is really upwards of 85% of people.
Primo. I just don't want to have that incredible result. Just la, 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 here we go. I want to do fireworks and stuff. Goodbye. Thank you.
Okay, so now we're going to dig into quite a few case studies. I'm going to take center stage for a second here. So I really had a hard time limiting these case studies. Roy made me cut back a few, but we really have so many hundreds of them, but I wanted to put in some new ones from this year. But with that said, this is an old case study that if you've heard us speak, you may have seen this before, but why this one is so important to me is because I started learning about SIBO in 2013, thanks to Allison Siebecker. And in 2017, I had this really recalcitrant case of SIBO in this client, and he was the first person I used a full elemental diet with, although I had been using elemental diets for many years before for other conditions. So at the time, this man had hydrogen SIBO. He was 30 years old. When we did his first SIBO test, at 60 minutes, he came back with 94 parts per million of hydrogen, and that number continued to rise to 133 by 120 minutes, which was the cutoff time being used in 2017. That 90 minutes, 120, that kind of goes back and forth depending on the provider. His second test we did after doing a low sugar, low carbohydrate diet, 2 rounds of herbs for about 4 to 6 weeks each, as well as a 2-week course of rifaximin. But unfortunately, his hydrogen levels remained significantly elevated, 147 parts per million, and his symptoms persisted, which was, for him, loose stool. So then we did the elemental diet. Post-elemental diet, his SIBO was eradicated. his peak hydrogen went down from 147 parts per million to 6 parts per million. That's 141 parts per million reduction in 2 weeks' time, okay? And I'm still in touch with him and his family. Since 2018, he has had regular bowel movements and feels significantly better overall, okay? This second case study is a recent one. This was a 72-year-old female who came to me with methane, SIBO, or EMO, intestinal methanogen overgrowth. So she was originally diagnosed with EMO in June of 2024. Between June and November of 2024, she took 3 different courses of antibiotics from her GI doctor. Her main symptoms were varied bowel movements ranging from a feeling of incomplete evacuation to softer stool, very stinky gas, cramps that woke her in the early morning, and she also had GERD and hiccups. So she did a SIBO test in March of 2025 with her GI doctor after all those previous treatments, and she was still positive for methane with a peak of 78.5 parts per million. Her GI doctor locally here is who sent her to me because she felt like she had exhausted all of these options with the patient. This client was open to doing an elemental diet, but she was honestly a bit resistant, and she was truly worried that she wasn't going to be able to complete it. The first 3 days of her elemental diet, she had some brain fog and the tip of her tongue felt a bit weird. She also had a little bit of GERD, but her stools were noticeably less stinky. And that was very, what's the word I'm looking for, motivating for her. And then after that, she kind of really coasted through the rest of the elemental diet. So when we did her retest, her peak methane was down from 78.5 to 5.38 parts per million. I spoke to this client 2 days ago. She's had no reactions to any new foods. I think she told me she was eating broccoli, peaches, onions, garlic, gluten, and dairy. Again, she has less gas, regular bowel movements, less reliance on caffeine, better energy and recovery. She's working out again for the first time. And she was thrilled that she's taking a quarter of the amount of the previous supplements that she had been taking. Her daughter got married right after she did the elemental diet this summer, and her friends and her family were commenting on how great she looked. She did not lose any weight. She didn't need to lose any weight, but she was just overall less inflamed. This next case study is a combined gas case study of hydrogen and methane. This is a 47-year-old female who was living abroad in Asia. She was diagnosed there with SIBO, and it was causing her a lot of worry and health anxiety. Her main symptoms were that she tended toward constipation. She'd go 2 to 3 days without a bowel movement, but when she had a bowel movement, her stool was looser. So this was the SIBO test they had done for her in Asia. She was mildly positive for hydrogen with a peak methane of 23 and methane with a peak of 19 parts per million. She was prescribed a course of antibiotics, rifaximin and neomycin. So after the antibiotics, she actually felt better, but when she looked at her SIBO test, it looked worse. So her hydrogen was now much higher, 75 to 86, and her methane was higher. Originally it was 19, now it was 33. And this really led into her health anxiety, causing her to feel depressed. So she took another round of antibiotics in January 2025 and started Motegrity. And by the time I met her this summer in June of 25, she was already on the elemental diet. So during the elemental diet, her stools were loose and watery for the first 2 days. And then by day 3, her symptoms were totally gone. She used many affirmations while she drank her shake, saying things like, "My digestive system is healing," to remain positive and hopeful and focus on her healing. She decided not to retest afterwards, first of all, because her other tests were done in Asia and she didn't want wouldn't have an apples to apples comparison, but also because she didn't want that to contribute to how her body was feeling based on her test results, okay? Because we know that testing is a good guide, but it's not the only thing. So in September of 2025, when I spoke to her last, she was having regular bowel movements. Her stool was perfect. Her constipation is gone, and she was having bowel movements 1 to 2 times a day. She had no more bloating, which she described previously as painful and 7 months pregnant looking. Her food reintroduction and expansive had been incredibly successful, and she was eating garlic and wheat again, 2 foods she had been avoiding. And she told me in her words that she was feeling so good. It was hard to accept it, but it's true. Any symptoms that she gets work themselves out in a day or two. And now we're just working together to correct some underlying nutrient deficiencies and really calm that nervous system, because as she says, she's really stressed about doing something wrong and ruining the progress that she's had. Okay, I got two more, guys. This is the second to last one. Okay, this is another favorite of mine.
Because I'm getting so stressed at how many questions we have. So
Okay.
ASAP, baby.
Okay.
Okay. We'll crank through the rest of it after this too.
Okay. Yes. Okay. So 62-year-old male, 12 years of treating GERD. Turns out it wasn't GERD. They did an endoscopy. His main symptoms were sensitivity, discomfort below his sternum, discomfort laying down, frequent need to clear his throat, and that led to his SIBO testing. He also tended toward constipation. He was having daily bowel movements, but they were harder to pass, causing fissures and hemorrhoids. Okay, so before test, peak methane 54, treated with Candibactin AR and BR for 4 weeks, went on a low FODMAP gluten grain-free diet, no sugar. Test after, SIBO was not eradicated or EMO was not eradicated. His peak methane actually went up. And then this test indicated he might have possible hydrogen sulfide SIBO. Didn't want to take antibiotics, and so he started on the elemental diet. After the elemental diet, peak methane down from 68 to 2.45. This test, I won't get into the details. Let's just say he didn't have hydrogen. The first test was invalid, but that causes a lot of stress for people when they see an abnormal after an elemental diet, but there might be reasons for that we have to ignore, okay? And then May 2025, after he was done, he was feeling very good. He would say his issues are resolved. And then I reached out to him when I was putting these slides together on October 1st, and he is still symptom-free after 10 months. I'm going to breeze through this last one. This last one, the only reason I wanted to put it in was great hydrogen sulfide. So this client had a 10 of hydrogen sulfide. I haven't shown one of those yet. During her elemental diet, she had normal, solid, easy bowel movements daily. Her gut felt calm, relaxed, and happy, had die-off for a couple days. Her peak methane went from 100 to 1.9, peak hydrogen sulfide from 10 to 2.02. Bowel movements almost every day after. Okay, did them.
All right.
Okay, I got more ball stuff.
Okay, great. It's hard not to get too excited about the success cases. Okay, so a few more things that elemental diets are really helpful for that's not SIBO is inflammatory bowel disease like Crohn's and colitis. Elemental diets are first-line treatment for Crohn's in many other countries outside the United States, and it's been shown to induce remission in up to 80% of those cases. And the thought is that it creates bowel rest, nourishes the body while allowing the intestinal lining to heal, reducing ulcerations and bleeding. It also supplies pre-digested nutrients, which helps correct malnutrition and maldigestion, which is common in severe IBD. And in pediatrics, it was shown that it was more effective than corticosteroids alone in maintaining healthy growth and nutrient status. Okay. In addition, it decreases inflammation by regulating pro and anti-inflammatory cytokines, like we mentioned already. The shakes are hypoallergenic, low residue, allowing for the immune system to calm down. And it also normalizes microbiome, like we just discussed at length. Okay, and it can be used in several different ways for inflammatory bowel disease. First off, we use it as short-term bowel rest, 3 to 5 days. If a flare is beginning, this can be an incredibly effective tool for people. And it's also used for deeper healing, typically bowel rest for 2 to 4 weeks, or sometimes even longer under the supervision of a physician. And this also has a massive effect. I just had a patient who had a calprotectin of 6,600 that went down to 300, which is still elevated, but a massive decrease from a 2-week elemental diet. And then it's also been shown that using semi-elemental shakes, the ones with the peptides, can be equal or possibly even more effective than elemental shakes for inflammatory bowel disease, especially when weight gain is a desired effect. It's also been studied for celiac. There's one study showing that people who had resistant celiac, resistant to gluten-free diets, had improvements after being on an elemental diet. And it was hypothesized that this might be due to the elemental diet also treating an underlying case of SIBO, or because of the anti-inflammatory effects that we discussed in bowel rest for the intestines. And then there was also studies with herpetiformis, dermatitis herpetiformis, which is a skin manifestation of celiac, and they showed that a 2-week exclusive elemental diet alleviated the skin rashes for those patients. It's also being used for
Oh, sorry. I thought that was me.
Okay. It's also being used for food intolerances and severe conditions like eosinophilic esophagitis, which is an inflammation of the esophagus, of course, for healing symptoms and symptom relief, for healing the gut and symptoms relief. And one study showed that it was a small study for pediatric patients with intractable eosinophilic gastroenteritis. They displayed improvement of their symptoms after a 2-week elemental diet. And actually 3 of those 4 patients were successfully able to complete food reintroduction and return to their normal lives, which is pretty amazing. And in our clinical practice, we've seen lots of clients who are able to tolerate a larger variety of foods like Debbie demonstrated after doing an elemental diet, which is great. And because it's similar to by itself is kind of like an elimination diet, it also has allowed others to more accurately identify the foods that they don't tolerate. And then another treatment is for pancreatitis. Chronic pancreatitis is a really painful and difficult to treat condition. And a 12-week low fat, which is important for the pancreas, elemental diet showed significant improvement in pain and quality of life for these patients. And then another treatment, another condition is rheumatoid arthritis. And they showed that in a clinical trial that a 2-week elemental diet was as effective as prednisone for pain and stiffness. Unfortunately, it did not decrease inflammatory markers, improve hemoglobin, or joint swelling in that study. And the question has been raised, is rheumatoid arthritis a disease that starts in the intestine? And pretty much anyone who's a holistic doctor or naturopath will tell you that we've been talking about that literally for decades. And yes, most likely. In our clinical practice, we've actually seen patients who don't have rheumatoid arthritis who show significant pain relief as an unexpected benefit of elemental diets. And another condition is eczema. There's a study in children who were treated with treatment-resistant eczema. And after 30-day elemental diet, the majority of these children showed improvement, and even 73% of them maintained the improvement for the 12-month follow-up of the study.
So elemental diets have not been specifically studied for weight management, but many practitioners observe clinically that those who are overweight and usually have some GI problems that prompt the use of an elemental diet tend to lose weight on them. But the flip side is also true, that I've had many clients who are underweight and they may put on some weight during an elemental diet because of the easy nutrient absorption, digestive, minimal digestion, all the stuff we talked about already. And this, leads us to think that there's some possible benefits and use for elemental diets with conditions like pancreatitis, cystic fibrosis, AIDS, cancer, and in the elderly population. And then just some additional benefits that we've observed clinically is that when people feel sick, food feels very confusing, the age-old, what should I eat question. And an elemental diet can offer a welcome break from that. And then without grocery shopping, cooking, and cleaning up, people enjoy extra time each day to do other things they need to do to take care of themselves. When we give any break from our normal diet, it gives us the opportunity to reset and renew our relationship with food. So I've seen clients also that after that 2-week break, they get off addictive foods like caffeine or alcohol or sugar. And elemental diets really appeal to people who don't want to take medication or who may be sensitive to herbs, or when medication and herbs have been resistant to, their particular type of SIBO or treatment.
And while elemental diets are incredibly safe in general, there are a few conditions that we recommend getting a little bit closer follow-up. And so, for example, with children, compliance can be a real issue. As Shivan said, the taste is better, but still not great. Monitoring their progress with calories and calorie intake and weight's really important. Pregnancy and nursing. In these cases, the benefits for the mom should really outweigh the potential risk for the child. Diabetics should be closely monitored for their blood sugar. And then clients with eating disorders, sometimes this can be very triggering when you put them on a very restricted diet. And then someone with these are people with a history, but people with active eating disorders, we generally do not recommend doing an elemental diet. And then while the formulas are not approved for tube feeding, there are commercial formulas. There are some doctors that do feel comfortable using them.
Okay, so now we are going to very briefly go through our 3 steps to elemental diet success. So we break down the elemental diet process into 3 steps: prepare, implement, and transition. Okay, these little boxes do not cover everything, but I just want to give you guys an overview. So when you're preparing for the elemental diet, you need to do things such as calculate your caloric needs, obviously order your shakes and supplies, really most importantly, understand the challenges that come up with the elemental diet so they don't catch you by surprise and you know how to deal with them. and then know how to transition onto an elemental diet, meaning you don't just wake up one day and start it. Generally, there's a transition to help your body ease into the elemental diet. And then also understanding what supplements to start and stop. During the implementation phase, that is the number of days you'll be on the elemental diet, whether that's 2 weeks, 3 weeks, 4 weeks. You want to know how to troubleshoot any symptoms that come up. And then, as I say here, mindset matters. This is not weeks of white knuckling. To make this a healing treatment, you need to be in the right mindset state for this to be a healing thing for your body, okay? And then lastly, transitioning off the elemental diet, knowing when to assess your symptoms, retesting for SIBO, and then moving beyond the elemental diets to the other things that prevent relapse of SIBO, rebalance your microbiome, calm your nervous system, all the things that are going to help these conditions, prevent these conditions from coming back.
And while an elemental diet is really simple, it's not necessarily easy, and it requires a bit of understanding, know-how, and discipline.
And what I say every single week is that those who plan for an elemental diet are planning for their success. And I truly, truly mean that. So after years of me personally working with hundreds of people and taking them one-on-one through the elemental diet, about 2 years ago, we created the Elemental Diet Success Plan. And the Elemental Diet Success Plan is a self-paced program that takes you through 14 video lessons that really break this whole process down into chunks, so you can dive right into where you need it. If you're on the elemental diet, you can dive right into, troubleshooting your symptoms. If you're about to transition off, you can learn what that process is like. Ideally, you get this at the beginning so you can prepare for the elemental diet correctly. We also have a course FAQ area that we're constantly building upon, which answers some of the more common and complicated questions we've gotten from some of our participants. There's 5 guidebooks that take people through this program. And this to me is, some of what we're the proudest of. So there's the Elemental Diet Program Workbook, which is literally a 50-page guidebook that helps you take yourself through this process and asks you all the questions you need to answer to get, everything in order. The Elemental Diet Supply List gives you the options of all the different shakes that are on the market these days, as well as additional supplies that some people might need given the condition that they're treating. Our famous detox support guide that helps you through your toughest of days. And then the transition diet recipe guide that tells you exactly what to eat when you're transitioning off the elemental diet and back onto food. And then the anal organized person in me gives you a program timeline that keeps you on schedule while you're planning, implementing, and transitioning off the elemental diet. So in the last 2 years, we have reached participants in 34 states across the country and 14 countries around the world. I will not bore you by reading these, but it really warms our hearts when people reach out to us and tell us that they felt that there was major gaps in this knowledge that the course answered, or that they truly don't think they would have been able to succeed without this course because that they knew exactly where to find exactly what they needed it when they needed it. And then for Shivan and Allison's wonderful community, we gave you guys a code to be used if you should want to purchase the course that gives you $50 off with the code SIBO50 through the next 2 weeks.
Awesome.
All right.
All right. Thank you so much. I did put the link to all of that in the chat. Beautiful. Let's put some love into the chat, I'll fix it so everyone can do that for these two.
Those success stories are just absolutely amazing.
So this really is a message of hope. Like, this is doable. You have support. If you're underweight, you heard them already talk about how that when done right isn't a concern typically. So that's a big fear I just want to eradicate right now. We will not get to everyone's questions, and we're all, like, everybody on your screen right now is so cute for thinking that we could have done this in an hour, but we're here because we did not want to wait till March. Seriously, it was like, and inside I'm like, I'm going to stop talking so I can start get your questions. But go to the link so you can see, and then we do have also a masterclass that was a $59 value that they did for us a couple of years ago, that if you did decide to sign up by 8 p.m. tonight and you send us your proof of purchase to info@sibosos.com, I would send that masterclass to you. It takes about 24 hours, and do that Send me the proof of purchase and give me 24 hours to get it to you. And then if you don't get it after that, email us. Be nice. Okay. With that being said, thank you all so much. And here coming in hot are some questions. Stand by. Dear goodness. Okay. Do I take supplements while I'm doing the diet? Quick answers, Debbie and Roy, because we're moving fast. I love you. Bye.
Okay. You guys have heard us say this before, but we call ourselves elemental diet purists. And so there are some things that some people may take during an elemental diet, but generally you mostly stop your everyday supplements. Yeah. Okay. But as always, talk to your provider if you're on something that for some reason you think should not be stopped for thyroid, hormones, whatever.
Okay. And you already addressed the weight. Wondering whether the elemental diet is okay with sensitivity to milk products.
Yes. Well,
that's all you need to say. It's okay. We won't
right formula.
There are formulas where you might want to avoid, but a purely elemental diet, yes.
Donna is asking about yeast. She has it in her gut. Does the elemental diet address the yeast or does it make it worse?
So this is that's like the age-old question that we have gotten from the beginning. And what I can tell you this many years in is I have never seen it make a yeast overgrowth worse. However, sometimes we do some prophylactic treatment for people that tend toward yeast overgrowth. And then secondly, it's not something that's been studied, although I was reading somewhere that they are going to study it for yeast overgrowth. I think Embiata put something out that they were going to look to studying it in this next year. But from my experience, it's never been studied.
Melissa's saying, I have completed Xifaxan and Allicin treatment, slowing due to antibodies, and I didn't take a prokinetic during the treatment. I'm planning on doing elemental diet next, but curious if you found taking the prokinetic during the diet helps improve outcomes. It's a great question and well put, Melissa.
Yeah. So in my opinion, and you guys tell me if you've seen differently, I would start the prokinetic after because it could be a little much while somebody is on an elemental diet and has no real food source. It's probably not necessary.
I don't think there'd be any reason that you'd need to.
Yeah.
Okay. I've also heard you say, for those of you who are hesitant, oh, it sounds good, I'm going to buy it, but then I'm not going to do it. For those of you with compliance issues and fear, does it taste different on different days? And the reason I'm saying that is because you said that, and I was like, that is so interesting. Can you address that?
It's a good question. Yes, absolutely. We both did elemental diets ourselves, and yes, I think it gets better the longer you take it. The first time you drink a shake, it's not great. I'm not going to lie, but even by the end of the first day, it was significantly better. And then I got really used to it. I didn't dislike it. But different shakes throughout the day do feel slightly different depending on your mood.
And I'm going to piggyback on that. What people taste the shakes, they taste different to different people.
For sure.
There are some flavors that my clients will absolutely love that I drink. You guys have heard me say this before. I'm like, that tastes like chocolate covered vomit to me. And I have people that love that flavor.
But even us, we do some taste tests with ourselves and friends. And so Debbie and I eat the same diet every single day. We eat the same food and we like the same foods, but we had very different opinions on the shakes.
Yeah.
Okay. What's going on if someone has diabetes?
It's not contraindicated, but what I would say is because it's a highly refined carbohydrate diet, this is not like a health food diet, right? This is not a whole foods healthy diet. So I would say you have to be really careful if you're monitoring your own blood sugars, know how to do that properly. And then I would recommend working with your endocrinologist for that personally.
And what you have to think about with diabetes is the whole premise of elemental shakes is, as I said, they're absorbed very rapidly and quickly. So they're, very simple sugars, and that is generally not what diabetics do best on. But, there's a lot of people that ask me about blood sugar. I'd say that's one of the bigger concerns people reach out to me for. And I would say that most people do really well on some of those glucose polymer formulas. The maltodextrins, tapioca maltodextrin is the main one that's being used. But even some of the other ones, they do well on just your average person that has unstable blood sugar.
Okay.
If I ever do another elemental diet, I might wear a CGM, continuous glucose monitor.
That would be fascinating.
To see what that does.
And remember, this is temporary. So when you look at the labels and some ingredients are like, oh, I would never eat that normally, because everybody hears this all the time. Remember, it's temporary. It's very specific. This does not mean you've blown your entire healthy lifestyle. It means you're reducing the overgrowth and you're getting your life back potentially there. Okay.
Also, you can do, of course, Debbie and Roy talked about this. You can do homemade if you really have to get
Thank
that
you, Dr. Siebecker. Yeah.
carbohydrate source down. Like if you find that you're spiking and it's just very concerning for you, there are options.
Dr. Siebecker created a homemade version that you can do in conjunction with Debbie and Roy's program as well.
Yeah.
For sure.
Yeah,
Like-
we have links to that as well.
Yep, it's in the link to her formulas in the program.
Right. Okay. I've done it 3 times, but each time I did it made my blood sugar issue worse, even if I sipped it and I didn't gulp it down. So we just talked about that. You do have techniques to help with that.
So, it might not also just be great for that person for their blood sugar.
Yep. Let's see. Mercy did the elemental diet for 2 weeks and it worked for SIBO, but finding it harder to repeat. Is 5 days as good as 2 weeks for SIBO?
So 5 days is good for a lot of conditions, but probably not enough to eradicate bacterial overgrowth.
Yeah.
But we do have, in the course, we talk about using what we call elemental diet resets, where you can do like 1 to 5 day elemental diets when you feel like things are flaring up and for various conditions. So it kind of depends on where that person is in their SIBO.
And people do have really good symptom relief from that.
Mm-hmm.
Right. And if anyone in this call does not know what a prokinetic is, I need to encourage you to get into the program, et cetera, and educate yourself, which we're not going to do right now, but that is the key. And that is the biggest gap I see with people getting better, because Dr. Siebecker even gave me a t-shirt that said, "Are you on a prokinetic?" because I asked that so much. And it's just a blind spot for so many people. Okay. Let's see. Will this work for hydrogen sulfide SIBO, intestinal methanogen overgrowth SIBO, and SIBO hydrogen?
They showed us success cases for all of those
There you
gases.
go. Okay, great. Are there any brands of the elemental diet that you would recommend for a person with multiple food allergies?
So there's definitely a lot of different brands, but I would say what they really want is to find an amino-based formula.
Yeah.
And then, as Roy spoke to, looking to ones, that like some of the older formulas have some corn and soy in them. Now, granted, they're broken down into aminos, but I would still not have formulas that have, any of those potential allergens.
Bob, do you have to have the stevia?
No, not all formulas have stevia. They're coming into more and more formulas, but that's also another question I get from a lot of clients. There are ones without.
You're going to have to just do yes or no's at this point. I don't tolerate magnesium supplements. Do people like me typically tolerate the mag and the Mbiota shake? Good. He said yes. That's great. Okay. Hi, Lamar. Is elemental diet appropriate for a person with IMO and gastroparesis with stomach emptying of 20 hours? So we've established it's good for IMO, but that gastroparesis, which is slow stomach emptying, what do you think?
You know about that?
No, I don't think that's been specifically studied. I mean, what I would say is, again, I think since you need to consume something, I think this would be certainly safe to consume, and it's liquid, so it's more likely to get through a little faster. But you might need to work a little bit on the gastroparesis first.
And you're not requiring digestion from
Right.
the shakes.
Yeah, it doesn't need to be digested, but it does need to make it out of the stomach.
Right.
So
Yeah.
I think it depends on the kind of severity of the gastroparesis.
And obviously drinking it less often,
Mm-hmm.
What options are there for, this is ROUXNY gastric bypass patient? I was unable to successfully finish the Mbiota due to reactive hypoglycemia.
So Mbiota is that has more sugar in it. There are formulas that have that are primarily more of the glucose polymers. That might be a better option, like Physicians Elemental Diet Dex Free or AP Amino, both flavors.
For someone with chronic SIBO, how many times per year do you think you might need to do a 2-week elemental diet? Of course, they can't answer it because they don't know your case. And are you doing a prokinetic? And hopefully you're not having to do it a second time. Like that's the goal. Okay, I bought 2 different brands. What's your thought about mixing elemental proteins in the same day or one? Like, can we switch brands?
Yeah, I have strong opinions about this when people ask me. So, I mean, we generally want to do what's going to get someone through an elemental diet, but I don't like to combine companies. Like if there's a company that offers two different flavors, I'll let someone do, say, like the original and the orange, or they'll do like the orange and one chocolate shake a day. But I don't generally love that because the scientist part of me wants to know, like, if the treatment isn't effective, like why, So then we can't switch formulas.
But
Right.
theoretically, it shouldn't make a difference.
But
if it means that, okay, if I don't get a chance to have a different something else in my mouth right this second, or I'm going to eat a sub sandwich, I'm sure you'd be like, just do a different brand.
Exactly.
I'm on the other side, you guys. I'm like, so long as you're getting your proper calories, take whatever flavor and brand you want. So sorry, I'm on the other side.
Yeah.
Oh, that's what.
There's not a
He's
right.
on the other side.
Yeah.
I'm the one that's
Yeah, there's no reason to believe you couldn't use different formulas. Debbie's just trying to be more
I want to be
rigidly
more scientific that way. Like if it doesn't work for something, we, can say, okay, maybe we should try a different formula. But as you guys know, when we enter in many variables, we don't know why something wasn't effective.
Okay.
But hopefully it's effective.
Hopefully it is. All right. Every elemental I've tried except elemental all chocolate make me nauseous and kill my appetite. Is it safe to drink only that product for 2 or 3 weeks for IMO? Yeah.
Yes.
Yeah. Remember, it's temporary. So is this similar to Soylent? Soylent. This is not like Ensure or like Pedialyte. These are very, very specific formulations. I don't know what soy. It's not like getting soy milk from the store. Fructose seems to bother me. So honey. So curious how this diet shape helps to fix it if triggering. Helps to fix it.
I mean, again, I would say maybe if they could use the ones that use the glucose polymers.
Right. Okay. Okay. There's magnesium and Ambiota. You said it would be fine. It probably should be fine. Let's see, we have a lot of the sugar question. I wasn't able to eat for a period of weeks last year and lost a lot of muscle and ended up with wrinkly skin. Does this also happen with the elemental diet? Hi, Anne. Not really.
Yeah, I mean, again, it's such a short treatment period, and I've used elemental diets with clients going through cancer treatments to just bolster their caloric intake and help rebuild.
Yeah, you shouldn't be losing weight on the elemental diet. I mean, we talk about this, everyone loses a little bit of weight because you're not eating solid mass, you're not generating a lot of feces during that time. But that all comes back very quickly once you start eating food again. And people shouldn't lose weight if they're getting the proper amount of calories. As a matter of fact, we talk about this, but you can increase your calories within reason to make sure that doesn't happen.
And one more thing I'll add to this is Ginny Patel Thompson, who created Absorb Plus 30 years ago, did so coming off of her worst Crohn's disease flare ever, where she was malnourished, drank elemental shakes for, I think, 6 or 8 solid weeks, and went right from there into getting pregnant and having a healthy pregnancy because it just, boosted her body and put so much, good, healthy weight back on her. So
let's clear up. You're not doing antimicrobials and you're not doing herbs at the, antimicrobials or pharmaceuticals while you're doing the elemental diet.
Exactly.
Yes.
It is its own thing.
It is its own thing. Right. Okay. Somebody else is asking, here's the link for the program. There it is again. And they use SIBO 50 as the coupon for $50 off. And then also email us at info@SIBO@SOS. Info@SIBO. What's my email address? info@SOS.com. Thank you. With proof of purchase by 8 p.m. tonight if you want their masterclass that they did last time. If anybody's put questions in the chat, you have to come to the Q&A box because it's out of control. I love you, but you have to come over here because I can only do one thing. Okay. Janet, hi. I just began low dose HRT for osteoporosis. I know this can slow down digestive motility. I'm a chronic SIBO sufferer. Oh my gosh, I'm so sorry. Due to slow motility, I am planning on doing the elemental diet next month, but worried HRT will cause SIBO relapse, even if the elemental diet is successful.
So, what I always say to that is, just like anytime we eradicate SIBO, whether it's with the elemental diet or something else, we need to work on the underlying contributors to SIBO. And so if motility is an issue, then things have to be in place like a prokinetic or, other things that support motility post elemental diet.
So lots of questions of, I'm going to do the elemental diet. Then, as I'm repeating myself, then I'm going to add the antibiotics while I'm on the elemental diet. So I really get it. What are you going to say to that? Don't do that.
Yeah, I really like people to have a period of time where they see where things flesh out. And we talk about this a lot in the course. How you feel on day 15 after the elemental diet is not how you're going to feel 7 or 10 days later. So we got to give the body that time. And, if somebody needs to move on to, another treatment, so be it. But you got to give, that time and the space to assess, because, we want to preserve that microbiome. We are not looking to just layer these treatments on top of each other needlessly.
Okay.
And Shivan, was that question they wanted to take elemental diet and antibiotics at the same time?
Mm-hmm.
Yeah, that is not recommended.
Yeah.
And probably not well tolerated also, because, you when you take herbs, a lot of times you need something to buffer that, like food in your stomach.
Okay.
And antibiotics as well.
Okay. Yeah, this is the thing. Somebody's asking, is there a low FODMAP elemental diet? You know how you feel strongly about things? I feel strongly about this. So it's, go ahead and say things. Go ahead and answer that question. It's so beside the point. It's so beside the point. Please.
Completely low FODMAP. And
Yes.
It's a no FODMAP. It's a non-fermentable.
Non-FODMAP.
That's the whole point. It's 100%
non-FODMAP.
Yes.
There's not a single FODMAP in there.
Don't get sidetracked in FODMAPage, because that is just going to treat your symptoms. It's not going to get to the root cause. And as you know, I love all those great food bloggers because we're hungry and we want yummy treats to help us, that won't cause a lot of symptoms. But if you stop there, you'll be unhappy.
By the way, I just have to add about this thing, because this always comes up about taking antibiotics or herbs. The premise that Dr. Pimentel speaks on, maybe we'll get research to see something different in the future, is that the bacteria go into hibernation mode and then they're not replicating, and you need bacteria to be replicating for pharmaceutical and herbal antibiotics to properly kill them. So there is no point. So just want to make that clear.
Yeah.
And there's one exception, which is Atrantil, which Debbie, you do sometimes. And that's because it works differently. It's not so much killing. It's actually stopping an enzyme reaction to bring methane down. So that's the only one we would ever consider using with, and unless you want to say something else, Debbie.
No.
Yeah, we cover that in the.
Yeah, you sum that up perfectly.
Yeah. Okay. Okay, the other thing that a lot of people are asking about is, how do we rebuild after? Remember that Dr. Pimentel has shown, because he and Dr. Rezai have mapped the small intestine microbiome, that once the bad players of the neighborhood, being the overgrown microbes or organisms, once they're gone, the neighborhood comes back into harmony in a way that is so beautiful. You don't have to overthink about reseeding, SEEDING, the gut, because when the bad players are there, the good players can flourish. So that's.
And Shivan, the best way to reseed the gut is to do like all those testimonials that I showed. Eat a more varied diet, like
absolutely
all the things that you were limiting previously.
Right. So let's see. Please speak to the effectiveness differences one would see after 2, 4, or longer weeks if someone has hydrogen SIBO versus hydrogen sulfide versus EMO. Have you noticed a difference?
So the only thing I'll say to that is that how long somebody goes on an elemental diet for SIBO, I really assess based on how they're doing on the elemental diet. Some people are really like toward the end, by the time they get to day 12, it's like, oh my God, I can make it 2 more days and I'm good. And then other people, I mean, Roy felt like this when he was on it and he did not have SIBO, but he felt, I mean, you speak.
Yeah, I had other digestive issues and I felt amazing on it.
Like he could have kept going.
Yeah, easily.
Yeah. And so I have had clients who stay on for 3 weeks or maybe even a little bit longer, because they can tell it's really giving their gut this welcomed break. Their nervous system is calm. And like I said, I have other people who are like counting down the minutes to get off of it. That's not a healing state. Okay.
Right, exactly. So Vita, we just answered that. And then, okay. How would you know if the bacteria are in hibernation mode or not? What actions, things can we eat or drink or lack thereof would result in a hibernation or activity replication going on?
Hibernation is when they're in starvation. So that's what this elemental diet does by using elemental diet, or if you stopped eating.
Okay. Speaking of which, Dr. Siebecker, so you don't recommend low FODMAP or SIBO specific diet while on antimicrobial treatment? I don't
That's
know
an
how.
entirely different thing. Let's stick to
Yeah.
the elemental diet here.
Yeah. Yeah. That's
That's for herbs and antibiotics, but let's
Got
just stick to elemental diet
Yeah.
today.
Okay. Let's see. How long after the elemental diet should you retest?
For SIBO, you should retest typically on day 15 if they were doing a 2-week elemental diet, or, day 22 if they were doing a 3-week elemental diet, or somewhere in between if they're doing between 2 and 3 weeks.
So if you have the high antibodies from the IBS SMART test that show that you have IBS from food poisoning,
Yep.
that could be an underlying cause, or endometriosis could be an underlying cause. Whatever the underlying cause is, this still works.
Yes,
Based
except
on
it doesn't address the underlying cause.
Got to get on that
The
prokinetic.
underlying cause is a motility issue. You have to address motility. If it's endometriosis, you have to address scar tissue,
Right.
So
Great. Yep. Perfect. Okay, we have 4 minutes. Can you guys, Debbie and Roy, would you do me a favor and turn off your mic and call me? And I'm going to turn off my mic because I have an idea. So here's my little phone. I'm going to have it right here. You just call me, but you got to turn off your mic. And Allison, sing a song.
So then I'll answer that question.
Yes, there you go.
Okay.
Perfection. Perfection.
Okay, great. So my understanding is the question is, if you're using pharmaceutical or herbal antibiotics, what kind of diet do you do during that time? Because during elemental diet, you're not eating, right? So that's why I'm assuming the question is that way. I think the best thing to do is stay on whatever diet, whatever SIBO diet you were on that was helping your symptoms. So if that was low FODMAP, if that was SIBO specific. So I actually favor being on a SIBO diet during those treatments. What you might be thinking of is that Dr. Pimentel has at times discussed that he has a different way of doing it, particularly with pharmaceutical antibiotics. He likes it when people are not on a very restricted diet. You could be on a somewhat restricted, but not very restricted, because he is concerned that if you go so low in carbohydrates, you might be putting the bacteria into hibernation mode, like we just talked about, and maybe the antibiotics won't work. However, I can say from my experience, I've had people on 5 foods have excellent results from herbs or antibiotics. So in my personal experience, I don't see that as a problem. I think you can be very restricted on your diet and still have excellent gas reduction, because I've seen it time and again.
Okay. Thank you. Thank you very much, Dr. Siebecker. Okay, this is what I worked out with Debbie. Roy, surprise, because we do have to go. But if anyone does decide to join the course, they will do about a 45-minute Q&A for the group, probably sometime in mid to late November. So that will give you time to sort of get started, deal with the materials. That's so generous of you. Thank you so much. So I really hope that you will take advantage of this course. It will be life-changing for the better. They are obviously fantastic at it. And we thank you so much for coming today and for taking good care of yourself, and know that there is hope. And if you're really ready to finally, once and for all, deal with your SIBO and really get those answers, I want to encourage you to take this course if it's a fit for you. If you're like, you know what? I've been wanting to do that elemental diet. I didn't know about those rates. Oh, they made it taste better now than vomit. Oh, I'm in. That sounds fun. That sounds good. I did hear a long time ago one woman say, I wish I had done it sooner, because
one woman, geez, just about everybody.
Totally.
This is what she said. This person, Dr. Siebecker, she said, I'd rather have done like 17 days of difficult than live with this the whole time. I wish I had done it first.
That's right.
We hear it over and over and over again. Yes, there are other ways to deal with it. Yes.
My 72-year-old client that I gave the testimonial just said to me, I wish my doctor had sent me to you before she gave me 3 courses of antibiotics in, a year period. I would have done this, and saved myself a year.
Done.
And that being said, there are other options. So I don't want anyone to feel like, I don't want to do it. And like, I'm doomed. There are other ways to treat it and address it. This is the most efficient and the most effective, okay, and fastest. And that's why we're offering it to you, so you can have that as an option. So know that you have power. know that you have choices, and know that you have made your own luck by showing up today. So with that, thank you. Mwah! Thanks, everybody. We'll resend
Thanks so much. And thanks for all the great questions.
Yeah, fantastic. And we'll put the link in the email that goes out today. But do remember, if you want the extra masterclass from them, to get it wrapped up and sent the proof of purchase to us by 8 p.m. Eastern time tonight. Otherwise, the discount is going to still last until the 30th of November. The 14th, 15th of November. So all good. Well, thanks, everybody. Take care.
Bye.